Hey everyone, Dr. Eric here once again. Hope you're doing great. So today we're talking about mapping out your ideal career path. This is your vision for your future, and we're going to get right into it. So have you thought about where you want to be 1 year from now? How about 3 years from now? How about 5 years from now? And maybe about 25 years from now. So mapping out your career path just isn't about getting to a particular state in your career or an income level, but it's also thinking about the type of career that'll fulfill you both personally and professionally. When you start with career planning, you want to start with a vision of what you see so that you can work backwards to help you get to where you want to be, right? So when you think about creating that vision, there's a couple of steps to that. First, you want to be able to begin with the end in mind. That is, see yourself where you want to be. In this instance, I think aiming for a 5-year vision seems to be pretty on target, right? So beginning with the end in mind allows you then to work backwards from that standpoint so that you can get to where you want to in that regards. So why is that important, thinking about where you want to be in 5 years? Well, if you want to get to somewhere in 5 years, you need to allow yourself both opportunities and enough time in order to get there, right? So 5 years may seem like a long way away. You're just probably thinking, hey, I want to get my first position, get comfortable, manage some of the student debt, get on with my life, that sort of thing. But there are things that you can think about in those 1, 3, and 5 year benchmarks, right? Like, do you want to be in a niche area? Do you want to have a certain type of position in the company? For instance, maybe your year 1 vision is you want to complete a mentorship in manual therapy or some other specialty. Maybe in 3 years, you want to earn a specialty certification in something like manipulation, vestibular therapy, OCS certification, SCS certification, something of that nature in 3 years. Maybe in 5 years, you want to assume a leadership role in an organization, be in management, become a fellow, or maybe take a path towards clinical ownership, or maybe even self-development of a clinic on your own. So when you think about that 1, 3, and 5 year goal, particularly looking at that 5 year goal, you want to define 1 or 2 things that you can use in a short-term goal. We do this all the time in patient planning. Hey, we want to get this patient to a certain level of functioning. What do we do in the next few weeks? What do we do in the next month or 2? And what do we start with right away? Right? So when you have that vision, you can set yourself up for opportunities. Reach out to individuals who are influential in that area. Talk to and obtain mentorship. Research the specific jobs in regions that you would like to get to, right? And that allows you then to assess and start to appraise what those positions might afford you. So different career paths will help you get to those areas, and when you analyze each individual setting, you might have contributing efforts from those settings that will help get you there more directly. For instance, if you're looking for autonomous practice, you want to seek opportunities to really develop that direct referral communication, that direct referral interacting with patients that allow that type of autonomy versus a practice in which you have to receive referral in order for someone to come and see you. You might want to think, do you want to be in a structured system with a larger organization, like a large hospital system or clinic system, or would you prefer a smaller independent clinical setting that allows you maybe ready access closer to that ownership personnel? If you're really looking for autonomous practice, maybe you want to be in a home health setting where you can truly be independent, or in a smaller clinic, or do you enjoy collaborative efforts, right? And then of course, what is that specialty that you want to get in to, and how can you support yourself in that? Maybe it's vestibular, maybe it's sports, maybe it's ICU, maybe it's general orthopedics, post-operative care, non-surgical care. So beginning with the end in mind then allows you then to see, hey, with my 3, 5, maybe even 25-year vision, how do I make sure I add in elements to my experiences over the next couple of years, especially with that first position, to set myself up for success, right? Keep in mind that everybody has a plan until things change, right? So certainly you want to be open to the possibility that things change. Maybe you have some encounters, or you go through some life activities or changes of perception in your last clinicals, or you get inspired to do some sort of specialty. It's okay to become off course of what you originally have. It happens all the time. Not everybody fulfills directly A to B to C to that career, but some people take a circuitous path to that. So, in summary, your inspiration comes from your vision of what you see yourself in your 1, 3, 5, maybe even extending out to 25-year career path, right? Then you want to step back and think, how do I take actionable items in the near future in order to get to that and set yourself up for success? I would love to hear what your career path vision looks like. I'm happy to discuss that with you, or discuss it with your mentor, or somebody who's experienced in helping guide individuals through their career path, right? So for you, regardless of where you're at in your job search, I want to be useful to you. If you're just starting to look for job opportunities, love to hear about what you're looking for. If you've already accepted a position or looking at a couple of job offers, I'm happy to assess those offers with you. Just reach out. Feel free to reach out to me at Eric, E-R-I-C, at pacptot.com. That's Eric, E-R-I-C, at pacptot.com. Or you can reach out to me at 920-289-8564, 920-289-8564. I'd be happy to be of assistance to you as you look for your next step. If you're watching this video, you'll be receiving a text with valuable resources to supplement this discussion, and look forward to catching you next time.